All right, guys. So for class today, we're just going to do a recording of Chapter 3. Most of the quizzes from Chapter 2 looked really good, so keep it up. And again, just continue if you have any questions to message me or, come see me next week, whatever you need to do. So for today, for this recording, I'm recording it here Wednesday night. Thursday morning is going to be kind of crazy. So I decided, as you noticed, I will have put out an announcement. I decided to just do a video recording and post it instead of using the big blue button. That way I don't have to record this twice for each of the sections. It's just going to make it easier on me, make it easier on everybody that I'm traveling with on the soccer team. Keep everything on schedule and those kinds of things. So, again, if you have any issues with this, let me know. I hope this is going to work really well. So, just a quick note. I'm going to try and kind of buzz through this. I was looking at the lectures throughout the semester, and I'm a little worried. This one's kind of long compared to the other ones that we've done. But there's some others that are longer, and where I haven't taught this course before, I just want to make sure that we have enough time. So if you need to pause this at any point, feel free to do that. I'm going to try and speak somewhat quickly, but pause it if you need to stop and make a note or anything like that. And because I'm going to upload this won't expire. And so you'll be able to refer back to it as you need to. So if you miss something the first time through, you can always go back and look when it comes to taking the quiz and those kinds of things. I'm still going to post the slides, so you'll have those, but you'll also have this video as a resource. So let's get to it. So today we're going to talk about the human body. We're going to give kind of a quick synopsis on anatomy. Okay? So to be able to be successful in first aid, you really need to have a basic familiarity with anatomy of the human body and how things work. Being able to use proper medical terms is also really important when it comes to communicating with emergency medical services and all those things. Personally, I'm a little excited about this. That way, when I talk like an athletic trainer, you understand what I'm saying. So that way I don't have to change the way I talk teaching this class. It'll be kind of nice. All right. So, these next two slides are going to be really important. These are going to be on the quiz. So put a star next to these, especially the ones that are highlighted. Okay. Also keep in mind that when we're talking about right and left, okay, we're talking about the right and left from the perspective of the patient, okay? So when I'm looking at the patient, this looks like the right side. Wow, that looks really bad. Let's try that again. This looks like the right side to me, and this looks like the left side, but that's not the case, okay? Actually, we're going off of the patient's right and the patient's left when we're talking about somebody, okay? So, when we're speaking about right and left, this is actually right and this is actually left when we're talking about a patient, okay? When we talk about anterior, we're talking about towards the front of the body, okay? When we talk about posterior, we're talking towards the back of the body. So, the chest is on the anterior side of the body, whereas your shoulder blades or your spine are on the posterior part of your body, okay, on the back of your body. When we talk about superior, we're talking about, like it says right here, we're talking about the top, towards the top of the body, so the head. And usually when you talk these two terms, superior and inferior, we're talking about them in relation to each other, okay? So I wouldn't just say the head is superior. Yes, but in superior in relation to what? So I would say the head is superior to the feet, right? Or If I were to say somebody had a cut, I would say they have a cut on the superior side of their head, which means on the top of their head, not on the side of their head, those kinds of things. Okay? And you can combine these, right? Like I guess if you combine them, technically it changes a little bit, but the superior anterior side of their head would be like your forehead, right? Those kinds of things. Okay? Next. So some more directional terms. Lateral is in reference to away from the middle of the body. Okay? So if we come back to, well, no, that's okay. So we're just going to draw a cute little stick figure here and kind of give some direction. Okay? So lateral, if I change colors here, so lateral is going this direction. Okay? So farther from the midline of the body. Medial is anything that goes towards the midline of the body. So towards the midline of the body. We'll just kind of put a little M. I wish I had a mouse. This would be a lot easier. But lateral is away from the middle. Medial is towards the middle. Okay? So, for example, if I was talking about somebody's chest, okay, I would say if their heart was having an issue, which is on the patient's left side, okay, so kind of over here, right? I would say the patient has a cut on their left lateral side of their chest. Okay? Again, you're always using these terms in relation to like a body part. Okay? Whereas medial, like, for example, when we talk about the ankle, you have 2 bumps on your ankle on either side. Okay? Really big bumps. They're called the malleoli. Your lateral malleolus is on the outside of your ankle. Okay? Your medial malleolus is on the inside of your ankle. Okay? Think about that. Maybe I ought to use my camera a little bit. It's not going to let me. Okay. If you have questions about this, come see me. I can kind of show you some things. I may also post some pictures to help demonstrate this where we're not in person. Okay. Proximal and distal. These are really important. Okay. This is in relation to an extremity like your arms or your legs. Okay. Proximal is close to where your limb attaches to the body. Okay. Distal is distant or on the end of the limb away from your body. Okay. So if we're talking about a section of your body like your forearm, okay, down by your wrist would be the distal portion of your forearm, whereas closer to your elbow would be the proximal end of your forearm. Okay. Superficial, closer to like the outside of your body, right? Whereas deep is down inside. So a lot of times when I talk to athletes, I'll ask them, they'll say, hey, my knee hurts. And I'll say, okay, does it feel like it's further to the outside or more superficial? Right? I might not say that to them directly, but if they know what these terms mean, I might say that. Or does it feel deeper, like down inside? So that's one way to think about that. Your skin is superficial on your body, whereas your muscles are deep, right? So try and think of them that way. Pay attention to these. They're going to be on the quiz. Review them as needed, okay? All right. A little bit more about directional terms. So we use what are called quadrants to kind of divide up the midsection of your body, okay? So there are 4 quadrants. The 4 quadrants are labeled here, okay? So the ones you need to know, I'm just going to circle stuff. That's going to be easier, okay? So there's the right upper quadrant, okay? the right lower quadrant, the left lower quadrant, and the left upper quadrant, okay? Ignore kind of this other stuff for now. Really, the things that you need to know, okay? So the quadrants start at the belly button. So this is where the person's belly button would be, is right there in the middle, okay? Really, the things to keep in mind and to help you know where these are is to know where different organs are in these quadrants. So for example, your liver, which is this organ right here, okay, is in your right upper quadrant, which is the RUQ, okay? Whereas your appendix is in your right lower quadrant, okay? Your appendix is down in here. It's kind of buried, okay? If I erase these, I think this will be easier, okay? Your left lower quadrant, there's really not a whole lot of specific organs in there, mainly just portions of your intestines, especially your colon is in your left lower quadrant. Okay, your left upper quadrant is where you're going to find the majority of your stomach, which is this one right here, and your spleen, which is this one right here. So that way, it's important to keep this stuff in mind when you come upon somebody and they have a wound in their midsection. Based on where it's at in relation to their belly button, you can kind of have an idea of what might be affected, right? If you're calling 911, this would be something important to offer up to them. Like, hey, they have a wound in their right upper quadrant, their right lower quadrant. They have a lot of pain in their right lower quadrant, okay? Those are some important things. All right, so as far as body systems, okay, most life-threatening conditions are going to affect 3 different systems, possibly. The respiratory, the circulatory, or the nervous system. Respiratory is mainly your lungs, with some other things kind of sprinkled in there. Your circulatory system is your heart and your blood vessels. And your nervous system is your brain, your spinal cord, and the nerves that go throughout your body. Okay, and we're going to dive into those a little bit. The most important and sensitive organs that often pose the most life-threatening things are, of course, your lungs, your heart, your brain, and your spinal cord. Okay. So we'll dive into the respiratory system a little bit. This is important right here. This is going to be on your quiz. Okay. Death will result in about 4 to 6 minutes if the body's oxygen supply is cut off. This is really important, and I would say most emergencies that require CPR, that require life-saving measures, are to maintain the body's oxygen supply. Okay, and as I hope most of us know, oxygen from the air is made available to our body through the respiratory system. And we're going to dive into that a little bit. Okay. Pay attention to this. This is going to be a quiz question. Let me type that in. Okay. Perfect. So here's just a quick diagram. Again, I don't know that it's really important that we know all of the every single different little part of the respiratory system. We just need to know the big things, like the lungs, okay? Knowing the esophagus, okay, the trachea. God, I can't believe I said that. Okay? Knowing that those are part of the respiratory system, knowing that oxygen is going to come from our mouth, okay, down through our trachea into our lungs is important. All right. Some of the mechanics of breathing. Respiration is the definition, okay, of how air gets in and out of the lungs. Okay. Inhalation is breathing in. Exhalation is breathing out. Ventilation, okay, is the actual increase and decrease of the size of your chest cavity. Now that's important because when we do CPR, we are looking for the chest to rise and fall to know whether somebody is breathing. Okay? That's going to be part of our assessment as we come upon somebody who we are worried may not be breathing or may not have a heartbeat, those kinds of things. Okay? Ventilation is really important. Okay? Kind of like I mentioned earlier, the primary cause of cardiac arrest or your heart stopping is because of a respiratory problem that doesn't get fixed. Okay? And we'll kind of dive into this in a little bit. The heart has to have oxygen to be able to function. And if we're not getting oxygen to our heart, it quits. And so that is a really, really important mechanism to keep our body moving. And that's why CPR, that's what we're trying to restore correct is a respiratory problem to get oxygen where it needs to go within the body. Okay. Just some things to keep in mind for infants and children. They do have smaller respiratory structures. Their airways are really easily obstructed. Their tongue takes up a lot of space in their mouth, and their trachea is more flexible. So, again, it could be a larger issue for children than it is for adults, but I would say that respiratory problems, even in adults, are still the primary cause of cardiac arrest. Pay attention to that. That's going to be a quiz question. That one right there. Okay, put a star by it. Some things that I want you guys to know. Respiratory rates. Okay. The amount of breaths that somebody takes per minute is a really important benchmark for how their respiratory system is functioning. Okay. When obviously, as you guys notice, when you run, you're breathing a lot harder. Okay. When you're sitting, you're not breathing as hard. When we are testing respiratory rates, we are testing them at rest. Okay. So that means if this is something we want to look at, especially I would add this is something you may look at more as a criteria of whether, we talked about this last time, a criteria of whether to send somebody to the doctor or not, take somebody to the emergency room, is their rate at rest. Okay. This is why it's important, and this is kind of why I mentioned when we talked about transporting somebody to the emergency room, just if they got their respiratory rate's going to be higher if they just got done running or they just got done working, right? I had a doctor's appointment a little bit ago that I just come from doing some physical labor, and when they measured all my stuff, they took my respiratory rate, my heart rate, and all that stuff. They were concerned. They're like, "Oh, it's really high," and I was like, "Well, duh! I just came from shoveling a massive hole. So of course, my heart rate's going to be up, my respiratory rate's going to be up, and those kinds of things." So keeping that in mind as you're evaluating somebody as a first aid provider is really important, because just because their respiration rate for an adult, just because they're, having 50, 60 respirations per minute, breaths per minute, if they tell you, "Well, I just got done doing something really physical," well, duh. Of course they're going to be breathing harder. Okay. So that's why it's important that when I talked about prolonged increased rate of breathing or increased heart rate, these are the types of things that I'm talking about. Okay. So for adults, 12 to 20 breaths per minute while at rest. And as you'll notice, the younger you get, the more you breathe. So teenagers, 12 to 16, school age children, 6 to 12 is 18 to 30, preschoolers 22 to 34, toddlers 24 to 40, and infants 30 to 60. I don't think you need to know all of these individually. The ones that I'm most concerned about is this 12 to 20, okay? And then having a general idea that it's normal for kids to have higher heart rates, okay? Understanding that even though for an adult 30, 40, 60 is really high, for kids it's really not that high. That's within normal limits. So keep that in mind. Okay. But more than, counting breaths per minute, in an emergency situation, the biggest thing you're going to want to look for is signs, right? So the biggest signs of if somebody's having trouble delivering oxygen to their body is going to be things like this cool and clammy skin, okay, that's pale. Cyanotic literally just means blue, okay? That means they're starting to turn blue. All you guys have seen that, right? Like if you were to, when they draw blood and stuff and they put the wrap around your arm and it kind of slows down blood flow, you can see your fingers maybe start to turn purple or blue a little bit. That's because, yes, you're cutting off blood flow, but when you're cutting off blood flow, more importantly, you're cutting off oxygen to those cells. And that's why things start to turn blue. Okay? And then nasal flaring literally is just a sign that the body is working harder to get oxygen. So my son, he has a medical condition that affected his lungs when he was really young. And because of that, he, for a while, was really working harder to breathe. And so this was really important for us to watch as he was in the hospital, because they were trying to determine how much oxygen was enough to support his body so that his body didn't get tired and shut down, right? It didn't become overworked. So the nasal flaring was really important for us to keep an eye on to be able to see and indicate whether his body was working too hard for oxygen or not, okay? The circulatory system, the things that make up the circulatory system is the blood, the heart, and the blood vessels, okay? First and foremost, the heart, okay? The whole point of the heart is to deliver blood to our body, okay? A couple little facts that probably aren't super important to know, but are good to know. It's about the size of a man's clenched fist, shaped like a pear. It's in the center left side of your chest, just to the side of that really hard bone called your sternum. And that's right in the middle, okay? The heart is made up of chambers, okay? So if I'm not a great artist, but if we were to draw a heart, okay? Kind of looks like this, kind of comes to a point, and then it comes kind of around, okay? So the heart is divided into 4 chambers or quadrants, whatever you want to call it. Whoa, that wasn't supposed to happen. Is that going to delete the whole thing? No, just that. Okay, so these quadrants are what make the heart function, okay? So the upper quadrants, okay, are called atria, okay? Or you have 2 atria. So you have your right atrium, okay, and your left atrium, okay? And then your ventricles, you have a right and, oh my gosh, this is going to drive me crazy, and a left atrium. Sorry for the bad artistry, okay? The atria and the ventricles have different jobs, okay? The atria are the chambers that receive blood from the body or from the lungs. The ventricles are powerful chambers that pressurize and send blood either to the lungs or to the entire body, okay? So we'll kind of follow this procedure here in just a second, okay? So during each contraction, okay, this kind of skips a step. So as blood comes into the heart, it arrives into the right atria, okay? Then it goes from the right atria, it fills into the right ventricle. From the right ventricle, it goes to your lungs, okay? After it goes to your lungs, comes back to the left atria, then the left atrium, the left atrium moves the blood into your left ventricle, and your left ventricle has a powerful contraction and pushes blood to the rest of your body. Okay? Now, the reason that this is so important is through this process, your blood receives oxygen, takes oxygen to your body, and then comes back to your heart after it's been, your blood vessels are going to exchange that oxygen with carbon dioxide from your cells. And we'll look at this a little bit more in depth. Okay. So I'm going to look for and post a picture that kind of demonstrates this a little more clearly. Even if I have to draw one, I'm going to do that. Okay. Because I want you guys to understand this. It goes from, and maybe I'll show you guys a video at the end, kind of a little thing I use to remember it, but it goes from your right atrium to your right ventricle, then it goes to your lungs, gets oxygen, the blood receives oxygen, comes back to your heart, to your left atrium, then goes into your left ventricle, and gets pumped to the rest of your body. Okay? All right. So, and I guess to kind of clear this up, because the next slide talks about this a little bit. The actual, when you hear a heartbeat, right? You hear a lub-dub, okay? The actual contraction of the heart, when it pumps, that is when blood is leaving one of the two ventricles to go either to your lungs or to your body. It happens at the same time, okay? Some blood is going to your lungs at the same time that your left ventricle is pumping blood to your body. Okay, that is in the contraction phase. Okay, now in the relaxation phase, this is when blood is filling your atria. Okay, so right after the blood has after the heart has contracted, then as it's relaxing, the blood is entering the right atrium from your body, okay? And it is leaving, it is coming back to your left atrium from your lungs, okay? So I just kind of want you to have a general understanding of that. And I don't have a fantastic picture, so I will post a picture, maybe a short video on how that works, okay? If you have questions about that, please send me an email, send me a message, call me if you need to, and we can kind of talk through it, okay? Or, I know I'm going to be out of town for the rest of the weekend. Go ahead and send me an email, and we'll work out how I can help you understand that a little better. Okay, blood vessels. So the vessels that carry the blood when it is not inside of the heart, okay? So the first set of blood vessels are called arteries. This is important. You need to know this, okay? Arteries carry blood. Now, pay attention to this. This is a nice little tip because it starts with an A. Arteries carry blood away from your heart, okay? That means anytime that blood is, well, I guess that's not necessarily true, but anytime blood is leaving your heart, okay, it is being carried in an artery. Okay? Actually, it is true. Anytime it's leaving your heart, it is being carried in an artery. Okay? Coming from the heart, you have two large tubes. Okay? Two large arteries. These are your pulmonary artery and your aorta. Okay? Pulmonary artery is what carries blood to your lungs from your heart. The aorta, so the pulmonary artery comes off of the right ventricle. So when your right ventricle contracts, it's pushing blood through your pulmonary artery to your lungs. Okay? Your aorta attaches to your left ventricle, and it carries blood to the whole rest of your body. Okay? Now, the thing that really distinguishes arteries from these other vessels we're going to talk about is that they're elastic, but they're also muscular. So these things can actually contract to maintain pressure to push this blood to your whole body. It might not seem like a really long distance to go from your heart to the rest of your body, but it has to go a lot of places because literally every cell in your body needs that oxygen. And so it requires a lot of pressure. Okay. Next, we're going to talk about capillaries. So, capillaries, basically, and I'll show you in this diagram I'm going to show you in a second. Capillaries, that's a network of really small blood vessels. Okay, so when I talk about blood vessels, arteries, capillaries, and veins are all types of blood vessels, right? So capillaries are really small vessels where oxygen leaves your bloodstream and goes to the cells of your body, and the cells send carbon dioxide and other, shall we say, waste from your cells back into the blood so that it can later be taken care of, right? Carbon dioxide is what you breathe out later, okay, through the respiratory system, and then the waste goes to other places and other organs to be excreted out of your body, okay? But just know that capillaries are where this exchange of things between the bloodstream and your cells takes place, okay? Veins are what carries blood back to your heart, okay? So veins, as opposed to arteries, don't have muscle tone to them, meaning that they can't contract, okay? They're more of like, think of it as like one of those socks you have that stretches and doesn't really come back as well, right? It doesn't maintain its elasticity very well. So they can become larger and larger the more pressure that gets built up in them. That's when things like, if you've ever heard of somebody that has varicose veins, a lot of times in elderly people in their legs, you'll see these blue, really big veins. It's not because they're yacked. It's because those veins over time, over the years, have stressed out enough that they become large, and they actually become brittle, which means that they rupture really, really easily. Okay, but the veins are really important because they're what takes blood back to your heart, blood that is carrying carbon dioxide instead of oxygen, so that when it goes back to your heart and enters your right atrium, then your heart can put it through your right ventricle and back into your lungs to receive oxygen again. Okay? So I really just want you guys to understand the jobs of these different vessels. Another thing to really keep in mind, you guys have probably heard of like IVs, and when you get blood draws, they use your veins to do that. Okay? Veins are a lot easier to stop the bleeding for than arteries, and veins are a lot more accessible than arteries. So that's why blood draws are done through your veins, and where you put IVs. Okay. So here's just a quick diagram. So arteries, in most diagrams, you'll see arteries are red, depicting that. My gosh, I hate that. Let me try that again. Arteries are red, meaning that they are carrying blood that has oxygen in it. And veins are blue, which means it is carrying blood that doesn't have oxygen. Okay? These capillaries is where these fine little small vessels are at that are creating this exchange between these little cells right here. And they're doing... that's where they're exchanging the oxygen, the carbon dioxide, as well as nutrients and waste. Okay. So, pulse. This is going to be really important. We're going to talk a lot about pulses because this is really an important part of CPR. Okay. The definition of a pulse is a surge of blood every single time your heart contracts. So when you're finding a pulse on somebody, you're literally feeling an artery. You're not feeling a vein, you're feeling an artery. Okay? Any place where an artery is close to the surface of the skin is where you'll find somebody's pulse and where you'll be able to feel it. Okay? There's only certain spots on the body that you'll be able to find them. And that's what we'll look for as we're looking for the patient's pulse. And we're going to do an assignment about this. I'm going to introduce it next week because I want to be able to practice doing these in class together in person. So we're going to have an assignment where you're going to have to find different pulses. And so find the pulse of somebody in different areas, different arteries on people. And then they'll sign it off, and then you'll turn that into me. But I want to introduce that completely next week so that we can go over how to find them and kind of practice a little bit before I cut you loose doing that. So one thing to really keep in mind when it comes to, I'm sort of moving on, when somebody is bleeding, okay, blood that comes from arteries is going to spurt. And that is because it is coming from... because it goes with the pulse of your heart, right? Like the whole idea of your heart pulsing is that it's pushing blood through your arteries. That's why it spurts. Blood that comes from a vein that is cut is just going to flow. It's not going to come in those bursts because your veins they don't have muscle in them like your heart does, or like your arteries do, excuse me, okay? Keep those in mind. That's also going to be a quiz question. Okay, so put a little star next to those. These are the different locations for pulses. So the carotid artery or the carotid pulse is the one in your neck. This is the most common one to use when checking for before CPR. It is a really, really strong pulse because it's right next to the heart. Okay, your brachial pulse is in your elbow. Okay, your radial pulse is the one that's down by your thumb that a lot of people will use as well. The brachial pulse, also a little side note, is when somebody's taking your blood pressure, the stethoscope that they're using, they're putting it right on top of your brachial artery and listening for that. Femoral artery is down by your groin. Okay, your posterior tibial artery is back by your heel. On the medial side of your heel, so the inside of your heel, and the dorsalis pedis artery is on the front side of your ankle, okay? Kind of on the top of your foot, all right? Remember these, because these are going to be a quiz question, okay? And like I said, we'll review these a little bit more next week, okay? And the reason... also, that pulses are important besides CPR, and knowing where these different ones are that I wanted to mention, we can use pulses to determine if blood flow to an extremity is normal. Okay, so for example, an emergency situation that can happen in sports medicine, if, for example, in a slow pitch softball game, a guy gets whacked in the calf or in the front of a leg with a hit softball. Okay, one thing that can happen, there's not a lot of space in your lower leg, and if something swells up, it can start to push on arteries, nerves, those kinds of things. And not only is it comfortable, but it can be not life-threatening, but you can lose your foot because of it, or lose your leg. When those things start to swell up, there's nowhere for all that swelling to go and all that inflammation to go, and so it pinches off blood flow. And that's why it's such an emergency. So to check for that, you actually feel this pulse, this dorsalis pedis artery or the posterior tibial artery to see if you're getting a pulse there. Because if you're not, they're having this compartment syndrome, and it's really serious. It needs to be taken care of really quickly, or it can have some lasting effects. Okay. Blood pressure. Blood pressure is all it is a measure of the pressure exerted by the blood on the walls of your arteries. Okay. So when you look at blood pressure, there's two numbers. It's always like a fraction. Okay. And they'll always say, so using this number, it's 120 over 80. Okay. Because I'm typing side to side, it looks like that. Typically, you would write it like this: 120 over. God, that drives me flipping crazy that just keeps going like that. 120 over 80. Okay. Sorry for all the extra writing. I'm getting used to my laptop. Okay. So the 120 measures the pressure when your heart is actively contracting. The 80 is measuring the pressure when your heart is resting or relaxing. Okay, that's why the top number is always bigger than the bottom number. Okay, this is really important. This is going to be a quiz question. Okay, a normal heart rate or a normal blood pressure, for an adult is 120 over 80 or below. Some athletes can have blood pressures as low as 100 over 60. But 120 over 80 is normal for an adult. When we get higher than that, we're starting to worry about high blood pressure and can cause a lot of stress on your body. Okay. The reason that this is important, I know you're not going to have access to all these tools most of the time in an emergency situation with a stranger, but if you're at home and you have a family member that's feeling really crappy, you can check their blood pressure, and then based on that blood pressure, you can determine if it is safe for them to, continue to care for themselves at home, or if they need to go see a doctor. So that's why this number is really important. Okay. So blood, just to quickly talk about this, your blood is made up of two portions. There's a solid portion, which is the actual cells within the blood, and then there's the liquid portion, that all of the cells are in. Okay, so your red blood cells are what carry the oxygen. Your white blood cells are your immune system. They defend your body against different infections. Platelets are for clotting if you start bleeding. Okay, plasma, which is the liquid portion of your blood, is mostly water, but it will also carry some food materials that can be exchanged with your body's cells. And then obviously when it's after it's exchanged with those cells, it picks up waste to then excrete out of the body. Another thing I wanted to mention with blood is also really important for temperature control. So that is another really important part. A lot of emergencies relate to like I talked about earlier, oxygen delivery through the blood. Like oxygen is not being delivered where it needs to be taken. Or your body is not regulating temperature correctly. So when we talk about like heat stroke and hypothermia, a lot of times it's because our blood is no longer maintaining temperature within our body, okay, at a safe level. So we're going to kind of talk of an example of how important blood is within our body. Okay, so hyperperfusion or shock, most of you guys have probably heard of shock. All shock is blood is not circulating correctly through our body. Okay, some of the signs of symptoms is having that cool blue kind of clammy skin, having a quick pulse, but often it's pretty weak. And breathing really quickly. It's often associated with restlessness, anxiety, or mental dullness. They may be nauseous or vomiting. Literally, shock is because your blood is not circulating properly through your body. Okay, and that's where this low and decreasing blood pressure comes through. Your total blood volume it can be really low. and your body temperature decreases just because the blood is literally not carrying out its function. The reason I bring up this example, okay, I want to kind of use the things that we've learned about the blood and the circulatory system to help us treat somebody with shock, okay? So we know that these are all signs of shock, okay? We know what is the cause of shock, that blood is not circulating through our body correctly, okay? What are some things that we can do to help somebody that is experiencing shock, okay? I want you guys to think about that for a minute. Okay, and then here are some, and we're going to actually cover this in a different chapter, but I like this example. Okay, number one, regulate temperature. So we can help this person by regulating their temperature for them because their blood isn't doing it. Putting a blanket on them, making sure they're not wet or cold, and regulating their temperature because their blood's not flowing correctly, so they're not able to do it themselves. Okay. If that person is bleeding, we need to stop the bleeding, right? Their blood volume is going down, and because of that, they're not delivering oxygen properly to their cells. Their temperature, their body temperature is dropping rapidly, okay? The other thing we can do, if bleeding is stopped, we can use gravity to help circulate the blood a little bit better. Kind of like I talked about before, veins don't have musculature to actively push blood. So veins require a lot on gravity and pressure to be able to push blood back to your heart so that your heart can then pump it to the rest of your body. If we lay somebody down, okay, so that gravity isn't pushing against this blood, and then elevating their legs can help push some of that blood. We can use gravity to our advantage to get some of that blood back to their heart, and then they can circulate it better, okay? And then ultimately keeping them calm. This anxiety, this panic can cause a lot of this stuff to happen. It causes their blood pressure to drop and those kinds of things, and that's what causes all of these things. So trying to keep them calm can help calm things down as well. Okay. So moving on. This last part, I think we're kind of breeze through, but it's important that you understand the nervous system. Okay, the nervous system is made up of two parts. Okay, the nervous system literally is just a collection of nerve cells, and all that the nervous system does is it coordinates our body. Okay, the nerve cells or neurons receive stimuli from touch, from all of our senses, okay? And then they transmit signals throughout our body, and then we react to those signals, okay? Nerve cells, the regeneration of nerve cells is very different when compared to other parts of our body. Most parts of our body heal pretty easily. Nerves have a really hard time healing, and that's an important thing to keep in mind. Okay, so the two parts of the nervous system is the central nervous system, which is the brain and the spinal cord. The peripheral nervous system is everything outside of those. So all the nerves that run throughout all of your limbs, all of those are part of the peripheral nervous system. Okay, and the peripheral nervous system has two branches. There's the voluntary, which is things that you can control, right? Like movements, certain reactions, those kinds of things. And then there's the autonomic system, which is stuff that we don't control, right? Our brain sends the signals to the autonomic nervous system, and it does it all on its own, right? We don't, things like your heart rate. We don't think about every beat of our heart, right? Because it's not a voluntary system, it's an autonomic system. Okay. Speaking about the brain, a lot of this stuff I'm not super concerned about. Just know that the brain is, it's the brain of everything. It controls the nervous system. Okay. Our nervous system does also use a form of fluid called cerebrospinal fluid. It's kind of similar to plasma. It's really liquidy. It circulates through your brain and your spinal cord. It acts as a protective cushion around your brain. That way, if your brain were to kind of bounce around, which is actually a concussion, when your brain contacts your skull, the cerebrospinal fluid cushions that blow. It does also have a form of exchange for food and waste materials, like our blood does, but with the nerve cells in our nervous system, our central nervous system. Okay. The other part of the central nervous system is the spinal cord. It's literally like a soft tube, almost like a blood vessel, but it runs throughout all the different vertebrae in our spine. Okay. It connects directly to the lower part of the brain, and it is encased in those vertebrae to help protect it. Okay. There's 31 pairs of spinal nerves, but you need to know that the spinal cord is pretty vulnerable to injury. Even though it's surrounded by all these vertebrae, because your vertebrae move and you can bend your back and those kinds of things, it is vulnerable to injury. Okay. Here's just a quick little model of your central nervous system. Okay. Again, not super concerned about all the little parts of the central nervous system, just that you know that the spinal cord is here and the brain is here, and know that branches come off of the spinal cord and go to the rest of your body. Okay, so talking about the peripheral nervous system, all of the nerves that leave your spinal cord, those branches, like in that previous model, are your peripheral nervous system. Okay, you have different kinds. So sensory nerves, things that pick up things from your senses, like taste, touch, smell, those kinds of things are all sensory nerves. And then motor nerves are nerves that attach to muscles and send signals to your muscles to move and to actually act and contract. Okay. If a nerve becomes seriously damaged, that's not going to work. So, people that are paralyzed is because their peripheral nervous system going to, if they're a paraplegic, then it's just their legs. It's because there was damage to that part of their peripheral nervous system that it couldn't function. People that experience neuropathy, so those are motor nerves, right? People that experience neuropathy is when they start to lose sensation, especially in their legs. So that damage is affecting their sensory nerves, right? And so they actually become like numb, and they can't feel things. It's actually kind of a sad deal. Pretty common with diabetics, people who have diabetes. But your peripheral nerves are actually pretty well protected with injury because they're surrounded by muscles, skin, all those things, whereas your spine is actually fairly close to the surface minus your vertebrae, right? Things to know. The injuries to your peripheral nervous system are not good, but they're typically not life-threatening, okay? The things that affect your central nervous system, on the other hand, are life-threatening, right? Peripheral nervous system has more to do with the quality of life, like being able to walk, like being able to feel your feet as you're walking, being able to taste. Those are more quality of life issues, whereas severing your spinal cord will kill you, right? So those are important to be able to differentiate. Autonomic nervous system, really quickly, comes from your brain, sends signals out to the peripheral nervous system to control your heart rate, digestion, sweating, things that you don't have to think about. Okay. Any disruption in this system is a problem. Okay. Especially when it comes to heart rate and digestive system. Digestion can become a major issue, usually not immediately, but those are things to keep in mind. Being able to breathe, your body signaling your lungs to breathe, is a necessary system, and it all comes from the autonomic nervous system. Okay. Quickly, the skeletal system. The things that I really want you to know is just the general location of major bones. Okay. For example, your skull is in your head. Okay. Your skull is made up of two parts. There is your brain, the brain case, the cranium, and then there's your face, the smaller bones that make up your face. Your eye sockets, your nose, your jawbone, all those kinds of things. Okay. Some things to keep in mind. Your skull has a lot of different things in it, and it's really important. Basically, any major damage to your skull is an emergency. Okay. You guys kind of get the extent of that. Yeah. Okay. Perfect. Note that the front of your skull, just a little side note, when we're speaking about like concussions and those kinds of things, the front of your skull right here is actually the thickest part of your skull. And that's because that's where we take the most damage, right? So, because we walk forwards and not backwards all the time, our bodies have adapted, and that part of our skull is really thick to protect our brain. And that's why when you get a blow to the back of your head, you're more likely to get a concussion than if you get a blow to your forehead, right? The same way if you've ever hit a soccer ball, when you use your forehead, it typically doesn't hurt. If you hit it with the back of your head, it hurts, okay? Spinal column, just know what the spinal column is. I would note that being able to know the difference between these sections of your spinal column is important, especially these three: your cervical, your thoracic, your lumbar. Your neck area is your cervical. Your thoracic is more of your chest area, but in your spine. And then the level of your low back is more your lumbar. Okay. Your vertebrae are a whole bunch of different bones that are bound together with ligaments that attach them to one another, and muscles that help hold everything there. But you can receive a lot of damage to your spine by injury, okay, by accidents and those kinds of things. The thorax is what's known as the rib cage. The reason that your rib cage is there is to protect all of your organs. Okay. Know that any injuries to your thorax can cause can cause ribs to puncture any of those major organs. And so that is something really to keep in mind if you have any sort of accident like that. Okay. And this, the thorax is where it really becomes important to understand the quadrants like we talked about earlier and know what different structures could be harmed. Okay. Pelvis is made up of your hip bones. They kind of look like big plates. Inside of there is where your reproductive organs are housed, holds your bladder, your rectum, and the floor, so the bottom of your abdominal cavity that houses all of your major organs. Okay. Leg bones, know that your femur is your thigh, and then you have your femur connects to your knee joint. Patella is just another fancy name for your kneecap. Okay. Some things to remember. Know that your tibia and your fibula are your leg bones. Okay. It's not the tibula, it's the tibia. Okay. So your shin bone is your tibia. Your fibula is a little bone right next to that. Okay, that runs on the outside. If you feel up by your knee on the outside or the lateral side of your leg, you'll feel a big bump. That is your fibula. And those make up your lower leg. Okay. Your leg bones, your like foot bones are made up of your tarsal bones. Okay. So your tibia and your fibula come down and they meet your ankle bones. Those are called tarsals. Well, the group of them is called tarsals. They all have individual names. I don't really care if you know all those individual names. Okay. Your shoulder is made up of your shoulder girdle, which is your collarbone, right? Everybody knows where your collarbone's at, and then your shoulder blade on the back. Fractures are pretty common here because it's so mobile and you can do so many different things with your arm. Fractures are pretty common. Okay. The different arm bones, know that the humerus is the upper arm bone. Okay. And know that your radius and your ulna make up your forearm. Okay. Your radius is on the thumb side. That's why it's called your radius, because when you rotate your forearm, when you turn your hand palm up and then palm down, it's called your radius because your radius actually moves with your arm as you do that. Your ulna actually stays in place. Okay. Arm bones, it's just an extension of your forearm, but as it comes down, you have your carpals, which are your wrist bones. You actually have 8 little bones in here that make up your wrists. I don't care if you know those names. Know that they're called carpals. These long bones right here are called metacarpals. Okay? Just the 5 longer bones in the palm of your hand. And then from there you have your finger bones, which are called phalanges. The thumb is super important. It's really prone to injury because it's big and it kind of sticks out. But it also is really important to be able to do the things that we do. Pick stuff up, move things, all that. Okay. Joints are anywhere that 2 bones meet and that allow for movement. Some joints are more movable than others. Typically, the more movable a joint is, the more prone to injury it is. Things like shoulders, knees, ankles, super prone to injury. Wrists. Whereas the hip is less prone to injury because you can move your hip quite a bit, but in not as big of ranges as those other joints. Okay. Yeah. Your joints are made up of bones that are held together by ligaments. Okay. You have layers of cartilage between those bones so that when they rub together, it doesn't cause damage. It's kind of a protective barrier. And then you also have fluid in those joints to help it not be quite so rigid and a little more fluid. As far as the muscular system goes, there's 2 types of muscles. Well, 3 types of muscles, really. Although the second 2 are pretty similar. Voluntary muscles are muscles that you can move, right? Like you can think about it and move a voluntary muscle, okay? So skeletal muscle is voluntary, this one right here, okay? When I bend my wrist, I'm using skeletal muscle or voluntary muscle, okay? They're very prone to injury. Smooth muscles are muscles that line the inside of tube-like structures like your digestive tract, your throat, those kinds of things. Cardiac muscle is only found in the heart. Okay. Again, these 2 types of muscles, with very few exceptions in the case of smooth muscles, are involuntary, meaning you don't actively use them. You don't think about it when you use them. Okay, they are automatic. Cardiac muscle, like it says here, needs a continuous supply of oxygen and glucose, which is what we talked about earlier. A lot of times when your heart stops, it's because it's not getting the oxygen it needs to function. Okay. The skin covers your entire body, as you guys know. It's a really important protective barrier for your body to protect it from the things of the outside world, bacteria, damage, those kinds of things. It also helps regulate body temperature with the blood. Know that stuff. The dermis is the inner layer of the skin. Carries a lot of the blood supply and nerve endings, and sweat and oil glands. Okay, I kind of breezed through a lot, so that's the end of the slideshow, the end of the lecture. I breezed through a lot of that second half. Okay, that means I want you to know the basics of those things. Okay, I don't need you to know all the specifics. All right, I want you to understand that your femur is in your thigh. Okay, your tibia and your fibula are in your lower leg. I don't want you mixing. I mean, it can be a common thing, but not mixing up. Oh, like this person broke their ulna, which is in your arm, but they actually broke their leg, right? Like that's knowing those things is going to help you as a first aid provider. And then remember those things that I told you were going to be on the quiz. You've all done very well. I did notice a change from the previous quiz to this quiz. Like I mentioned before, feel free to use the slides, okay? These are for you to help you. That way when it comes to these other things that we're learning about, you're understanding them better. And kind of like I talked about earlier, especially when it comes to this anatomy stuff, all it does is make us better first aid caregivers, okay? First aid providers. So use the slides for the quiz. Shouldn't be bad, just like the other ones. I'll get it posted. Hopefully I'll get it written tonight, if not first thing in the morning. And I'll get it posted. It'll be due Friday night at midnight. Okay? If you have any questions, please send me a message, send me a text, send me an email, whatever it takes. And plan on meeting together in person on Tuesday. And yeah, I'll send out announcements as needed. Thanks, guys.